Right. Now, this is a simplified way of, I hope you can see, the slide. You can see the slide?
No, not yet. It didn't appear.
Okay, so sometimes it doesn't work, so I'll try again. Share screen. Okay. If you can see it, let me know, please.
Yes, it's clear now.
Right. Okay. Now, the second part of my talk actually is, this is my personal advice. Well, when I want to advise my juniors about what to do in their when they want to choose a career, what are the questions they really need to ask? And this is about the final destination. What is the career, my final destination? What do I want to do? Right? You want to land in your dream job. You don't want to go to a job and then at the end of the day, you no longer find yourself in there. Right. Now, these are 7 questions, actually. There might be more questions, but these are the 7 questions that I think, everybody would really need to look at. Right. You have to ask yourself, am I a clinician? Am I a clinician or somebody who doesn't want to work with patients? Right. Do I like patient contact or not? Right. Is there anything that can help me move faster in my career, my career ladder? Is there a job that actually takes me, to a final destination faster, right? Do I like to be highly paid? Because some medical jobs are much more highly paid than others. So, which one am I going to choose? Is money really an important element, right? I don't want to have any on-call commitments, right? Some people might say, oh, I don't want to be on call at all. Now, these are people who want to enjoy themselves, and these jobs are socially perfect. You don't have to wake up in the morning on a weekend and go for a round. You don't want to be called at night, at 3 in the morning or 2 in the morning because you are on call, right? I like to have a job with minimal burnout. This is a problem in healthcare. Some jobs are really horrible. They will definitely get you depressed and highly stressed, okay? So what are the jobs which have minimal burnout? I like a job which is less or shorter working hours, right? Now, some jobs really have so long, the working hours are actually unbelievable, okay? Some jobs are actually 12-hour shifts, okay? So what are the jobs that will have shorter working hours? Right? Do I like a job that will allow me to have mini retirements and small times off the service, or at least some sabbatical leave during my career? Right? You really need to look at these 7 questions and try to answer them. Right? Now I'm going to take you through them. Right? Now, if the answer is I like direct patient contact, means you like to be in contact with patients, then you are a clinician. Clinician means that you really don't mind actually having this sort of practice, okay? But then you have to decide, do I want to be a busy clinician or not a busy clinician, right? And the lesson we've learned that, yes, I applied to the National Guard, great hospital, fantastic place to work, but it's a very large hospital, a very busy hospital, okay? So, but if you want to go to a hospital which is, you want to do clinical medicine, but you don't want to be very busy, then you go for a small hospital. And then another tip here, right? Now, I go to a small hospital or a large hospital, whatever, but I'd like the hospital that has some private admissions, because this gives you this extra income, right? You can do your clinical work, but maybe do also some of your private work and then get some extra money. If you are, no, I don't want clinical medicine. I just don't like patient contact at all. I hate it. I don't like patient contact. Then you are after certain other careers. Right? Obviously, this is not an exhaustive list, But you can go for investigation services or quality improvement or hospital administration or public health, research institutes, or even medical education. You know, people who do academic medicine or full-time medical education, they don't see patients. They just, teach, okay? So you have to decide, do I want patient contact or no, I don't want patient contact. Now, moving faster in my career, and I'll tell you from experience, you know, to become a consultant might take you maybe sometimes 15 years, right? But if you join an academic institute, okay, it all depends on your, hard work, right? They have criteria, how much education of students, how many publications, what sort of publications, and so forth. So you actually achieve this criteria, and then you become a professor or assistant or associate professor, and so forth. So I actually noticed that actually people who go for academics, they actually go faster in their career because they reach the final destination, a professor, right? Maybe 5-7 years. You know, they don't take 15 years unless they are really not that active in acquiring the criteria, in getting the criteria to become professors and so forth, right? Now, I want to be highly paid. By all means, highly paid means that you have to do a procedure, right? In general, the specialties in medicine that are highly paid are the ones that have a procedure involved. And obviously, surgery is usually at the top. But then people who do endoscopy, interventional cardiology, dermatology, plastic surgery, right? These get highly paid. Another way of getting highly paid is just locuming, right? Because locuming, usually locums pay more than just having a regular job, right? And you see people going to the UK or USA just to do locum because they locum for 1 month and they get a salary of 3 months. Okay, so locuming is actually another way of actually being highly paid. There's obviously the bad social issues related to locuming because you are not settled in one place, you travel from one place to the other. So it doesn't work all the time, only for special people. And I know actually, again, this last week when I was speaking to that orthopedic surgeon, right, he was telling me about a Sudanese physician there who just do locums. He does 1 week a month at the locum, right? And he actually relaxes the next 3 weeks. Why? Because 1 week locum gets him enough money, just like he's worked for the full month, right? So some people get more money with locuming. Now, this is actually what is actually put in Medscape, and it looks at actually the income for so many professions. And you can see that plastic surgery, orthopedics, cardiology, urology, get the most actually, these $500,000 a year, plastic surgeon, okay, orthopedic surgery, again, close to the plastic surgery, and so forth, right? And you go down the dermatology, I'm sorry, these are the highest paid, actually. These are the highest paid jobs in the States, right? I don't want to have any significant on-call commitment, right? And then exactly the same as you don't want to have clinical commitment, then these are actually the jobs which you don't have. No clinical commitment, usually no on-call commitment, research institutes and medical education, right? I don't want to have a job, I want to have a job with minimal burnout. And again, this is from Medscape. And you can see that emergency medicine is the worst job. It stresses you out, gets you depressed. 60% of emergency medicine physicians are burned out. Burned out is really a serious disease in medicine, okay? And you can see that if you go down dermatology, pathology, oncology, these have much lower burnout rates. So, okay, maybe I'll do pathology or I'll do dermatology because the burnout is much less. So you can also get a lot of money and less burnout, okay? Well, obviously, if you get more money, you'll be less burned out, right? Well, not always, but it does work this way. Now, I like a job where working hours are short, right? We have actually learned that if you work in private, then they will squeeze you to get money out of you, right? So if you want to work shorter hours, work government and not private. Private hospitals, unless, in only very few occasions, they actually agree for you to have a fixed, not just an open anytime they call you. In private hospitals squeeze it out of you, right? if you are doing a non-clinical job and you want less working hours, you work in institutes where some of your work can be accomplished from home. And for example, somebody working in medicine, information technology, or whatever, they sometimes can work from home. Okay, some establishment run something called flexi hours. Flexi hours, they give you the opportunity to decide what hours of the day you want to work. And I have seen this in Britain, you know, they have these flexi hours. Okay, jobs that give you mini retirements or sabbatical leaves or frequent time off during your career, right? Now, this is usually sabbatical leaves and things are usually allowed in academic institutes, okay? And some of them are happy to give you some time off, okay? Or if they can allow you to go off for a year for charity work, for example. But there is a new type of service which I carry status in the USA. It's called the hospital service. And now this hospital service is people work 1 week on, 1 week off. The 1 week on is actually full 24 hours. You work 1 week on 24 hours a day, okay? For 1 full week, and then the next week you are off. And some people do 2 weeks on, 2 weeks off. You end up actually working 6 months of the year and being off 6 months of the year, right? It's a great way of actually having time off, okay? And we have a hospitalist service in our hospital, right? And we work 2 weeks on, 2 weeks off. So this week I'm off because of my hospitalist work arrangements, right? So there are some, you know, these 7 questions you really need to ask yourself when you want to decide on your career, okay? Right. So so I stop here and we stop the recording, and we'll go to the third presentation. So by all means, prepare your